Welcome, everyone. Thank you so much for joining us today for this session of Volunteer Voices. There might be other people joining us as we begin here, and we'll let them in as they come. Volunteer Voices is a time for us to hear from those who have served with Global Care Force. And my name is Rick Power. I work on the global program side of Global Care Force, and we're glad you're here to join us for this conversation with Dr. Jeremy Jones, who has volunteered with Global Care Force in Ukraine and is planning to go back again later this year. Dr. Jones is an anesthesiologist, and he's been in medical practice for a long time. Tell us a little bit about your specialty, Dr. Jones, as we begin here.
Sure. So I'm an anesthesiologist, but I do outpatient pain management. So mostly treating patients with chronic pain conditions and spinal injuries and joint pain, that kind of thing.
Mm-hmm. Very good. As we begin here, just a couple of house cleaning items. We're recording this call for future use, and we'll provide a link so that others can watch the interview later if they'd like. And at the end of our time together, we'll have time for questions and answers. So please hold your questions until then, and make sure your microphone is muted so that we don't have a lot of background noise. So let's start by telling you a little bit more about Global Care Force for those of you who might be just getting to know our organization. Global Care Force's purpose is to transform lives through volunteer service by connecting our volunteers with organizations serving people in need worldwide. Our volunteers serve with respect to other cultures and faiths. Our goal is to continue to provide primary care teams to areas where healthcare needs remain unmet or access to medical care is unavailable. And Global Care Force is a registered 501c3 nonprofit organizations. We're currently serving in various locations around the world, including Egypt, Jordan, Ukraine, Gallup, New Mexico, in Mexico, in Rosarito and Tijuana, and also in the Pacifica community of San Francisco. So you can go to our website and learn much more about Global Care Force. So, Dr. Jones, tell us what made you decide to volunteer with Global Care Force out of all the organizations out there?
Well, I found the organization, I believe, on the Ukraine's Ministry of Health webpage. It had a list of organizations that were already currently operating in the Ukraine. And as I started reaching out to different organizations, just for me personally, with family considerations, being able to go 2 weeks at a time was kind of ideal. It's very difficult for most, I think, people in practice to be gone for 2 months or longer, as a lot of places require. And the more I found out about it, the more I liked about their mission and what they were doing, and I felt like it was making a real impact. So.
Mm-hmm. And what was it about Ukraine that appealed to you, other than, of course, the crisis and need there? Was it a good match for your experience and skills?
Well, I mean, for me personally, I was military before I went to medical school, and so I'm comfortable in that setting. But I think really I wanted to do something. I had been reading a lot about Ukraine and the issues, and have some friends and neighbors here that are from Ukraine, and I just, there's something, I think, part of you sometimes it feels like you want to be contributing to I don't know, something bigger.
Mm-hmm. Sure. Yes. And as we talk, we'll be showing some slides of your time in Ukraine. And if you see one of these pictures and want to comment on it, or I may ask you about it. Feel free to jump in. Maybe you
Sure.
could share a story about someone you met or something that happened during your experience in Ukraine that really will stick with you for the rest of your life.
Sure. Yeah, there was one day in clinic we were down in Mykolaiv, out in one of the villages that had been occupied by the Russians and then retaken by the Ukrainians. And we went to visit a lady in her home, and she was very moved in what she had shared with us. Oh, I think actually there's a picture of it there. I forget that, but one of the things that she shared with us is that the Russians actually had occupied her town, but actually were living in her house with her,
Mm.
and hadn't really even left the house after they left. And so that's actually her on the left there, and that's me with my translator Eugene, who's also a senior internal medicine resident. He's actually just recently graduated, but that was a pretty powerful moment, and you kind of realize that, yeah, a lot of these people just, you know, just you being there is um, gives them hope.
Hmm. Yeah, and so as you've mentioned, our our teams sometimes work in a clinical setting, or even visit people in their homes or travel out to their villages. Can you describe a typical day in the life of a Global Care Force volunteer, or is there no such thing?
Yeah, I mean, you kind of fall into a rhythm. I mean, for the Ukraine missions, it really takes about 4 days of travel just to get to the first clinic site, and you typically, you are sleeping in a town that's nearby the villages, but still, maybe an hour and a half drive. So, typical day, you wake up, have breakfast with the team, um, travel about an hour and a half to the first village, do clinic for, as long as it takes, but usually, about 4 or 5 hours, eat lunch there, uh, and then travel to the next village, clinic, typically till like 5 or 6, or really whenever you finish. And then at that point, you would load up, drive an hour and a half back to the hotel, eat dinner, go to bed, and start the whole thing over the next day.
Hmm. And the team that you worked with, I know, included volunteers from the U.S. and perhaps other countries outside Ukraine, but it also includes many Ukrainian volunteers, drivers, translators, other physicians. Talk to us about those relationships and the kind of bonding that happens over the course of a project like this.
Sure. So, our team down there, it was myself, another doctor. There were two nurses. They were also Americans. And then we each had a translator that had another purpose. So there's like an intake. The nurses each had a translator, and they would help them do the intakes. Um, each of the doctors, myself and Steve, we both had a translator, and then there is a pharmacist, somebody who would explain she's not really a pharmacist, but she would explain how to use the medications and go
Hmm.
where the patients were clear on her instructions. But what ends up happening is, when you arrive in the country, it's the 4 or 5 Americans and the 4 or 5 Ukrainians. We all go out to dinner, meet each other. The next day, while we're waiting for the train, do a little sightseeing. Um, I'm sorry, not the train, but the first car ride. But what ends up happening is, it takes you travel so long. It's like, I think, an 8-hour drive from Kyiv to the first location, and so you're just in the car, listening to their music, asking them how to pronounce things in Ukrainian, and so anyway, you kind of develop close bonds with these people because you're working with them many hours a day, and then the ones that you're not directly working with, you're in a car with and eating breakfast, lunch, and dinner. So you really get to know them and kind of get a greater understanding of what their lives are like and what their kind of fears are, and kind of what motivates them. So I'd say it's
Hmm.
a pretty satisfying, gratifying relationship.
Thank you. Uh, Watching these teams during and after they return, I've seen the kind of communication that goes on between the volunteer physicians and the Ukrainian volunteers. And it's obvious that you get quite close during your time together. Um, as a US-based physician, I'm sure you're used to having almost everything that you need to treat patients. Talk a little bit about what it's like when you go into a low resource area like Ukraine, and maybe some of the frustrations you experience when you're not able to provide what the patients need in every case.
Well, low resource is the key word. And, the way the missions are organized is you go out to the site with everything that you think you'll need. That being said, you can't possibly have everything that you need. And so there are some times that you're trying to tie in with, most of these villages have like a local nurse. And so you're trying to explain to the nurse, like, this is the follow up care that this patient needs. Like, I can't do an echocardiogram here, but I'm certain that this patient has aortic stenosis and needs follow up care. And so you're just trying to communicate with the people who live there to kind of make, to hope that they get the care they need. But I would say for the most part, we have um, a lot, most of the medications that people need. And, it gets kind of frustrating towards the end of the trip when you start running out of certain medications and you have to say, well, I know you normally take, you know, um, this ACE inhibitor, but we don't have it. So we're going to have to figure out something else. And, um, so that's just kind of one of the things about being flexible and
Sure.
adapting. You just know it's.
Hmm. So you're signed up to go back to Ukraine in December. I think, at Global Care Force, we're always honored when people like yourself volunteer with us, but even more so when you sign up to go back again. What motivated you to sign up and go back?
Well, if I'm going to be honest, whenever I do, when I've told my wife this, and I think I probably have mentioned it to somebody at Global Care Force, but I was impressed with the uh, efficacy or the efficiency of Global Care Force because a lot of times what happens is when you do something like this, you almost feel like a tourist. You're not actually doing much. And you
Hmm.
look back and you're like, well, I mean, I remember doing a medical mission trip when I was in medical school. And I just remember thinking, there's a clinic right next door to us. That'll see, it's just sort of like, what are you doing? The thing that struck me about this is I know that these people that I saw would not have gotten their medications that month without us. And there are some people who might have had, you know, hypertensive crisis or ischemic, cardiac events without some kind of intervention or follow-up care. And so I feel like it is having an impact. And I actually I enjoyed the trip. I mean, it's not a vacation. I'm not saying that. It's the travel is harder than I anticipated, but the work is very satisfying. And I remember a sensation leaving clinic one day, just feeling like like my heart was full. Like it was a good day. We got a lot of work done, and I felt very satisfied.
Thank you. So for those who might be listening, what advice would you offer to someone who might be interested in volunteering with Global Care Force?
Um, I would just say, look at your personal situation, see if it allows it. And if it does, then I don't think that you would regret it. I mean, I think that, um, you know, there are some challenges that that to me are just not that big of a deal about, just traveling and time zone changes. But I think if you want to do something and you feel like, you can do it and you feel that drive, then find out as much as you can and then just do it.
Great. Well, I'm not a physician, but if I was, after listening to you, I would try to figure out a way to be a part of one of these projects. It sounds like a transformative experience, not only for the people who receive medical care, but for the volunteers as well. Thanks you so much for your time today, Dr. Jones. There are a few people on the call, so if anyone has a question, this would be a time to speak up or put your question in the chat, and we'll let Dr. Jones respond. And while we're waiting for that, let me just talk a little bit about how you can become a volunteer with Global Care Force. The process really is very simple. You just need to complete the online application, and then we will set up an interview with you. There's a QR code on the screen that will take you to the registration form. We'll show that to you in just a moment. And if you're a good candidate with the qualifications we need, you'll be asked to submit the required forms, and then we'll begin a screening and credentialing process. And of course, we are serving in different places. Sometimes we're not able to give an applicant their first choice of a location to serve. So we might encourage you to consider one of our other locations. And we do our best to find a place for all qualified volunteers.
Did you see the question in the chat?
All right, we do have one question. If you can read it, Brenda, I'm not able to bring it up right quick here.
I'd be happy to. Dr. Cordova is asking, for someone with sleep apnea, would there be a place to plug in a CPAP at night? I'm guessing that we would need adapters for electrical devices, including chargers.
So I'm sorry, I made a mistake of hitting something on my thing, and now I can't get out of it. But yeah, so basically before you go, there's a series of meetings that will kind of make sure everybody's prepared. But one of the things they talk about is having just the proper, I think it's a converter and an adapter, and you can get them from Best Buy, and pretty much every hotel you stay at has a converter and adapter. And I think even if you probably lost it, there's places to buy them, and people on the team have extras. So I think, I'm assuming the CPAP device is just kind of a standard outlet. Yeah, I think you would just plug it into your, adapter converter, plug it into the wall. Should be fine.
That's an extremely practical question, and with so many people needing CPAP machines these days, that's good information to have. All right. Well, if you're listening to this interview live or later on recording, if you know someone who is interested, or if you have further questions, please reach out to us directly or visit our website. And you can follow us on social media, on Facebook, Instagram, and we hope we've left you with a better understanding of Global Care Force and answered your questions about our volunteer opportunities and experience. And as I mentioned, there will be a link to this recording and a link to the volunteer application and volunteer contact email information. So feel free to follow up and get in touch with us. Thank you very much for joining us today for Volunteer Voices, and hope to see you next time we meet.